About the staffing, though, it's all very well having ventilators. I'd like to just come back to this point. We have lost, we are down 50,000 nurses in this country, and most particularly for the ventilators, you need critical care nurses. Where are the staff going to come from?
I mean, the government does say you've got
to supply the ventilators, but where are the staff coming from?
OK, the government says that has written a blank cheque to the NHS on coronavirus
this week. But you can't come up with critical care nurses to staff ventilators just like this. These are the people that we should be welcoming back into this country. Come and staff, come and look after our patients. That is a real worry.
You can have the equipment,
but you need the staff on the front line to look after the patients.
How fearful are you about
Very fearful. We will lose our colleagues. We will be burying our colleagues. We know that. We know that's happened in China. We know that's in Italy. But let's not make no mistake about this. The medical front line is ready, willing and able to try and help deal with this pandemic. But we must have faster testing, more equipment, and we must have the proper staffing to try and help us deal with this.
It's really sobering hearing you talk about burying your colleagues.
Yes.
And obviously the Prime Minister today talking about preparing people to lose their loved ones.
There seems to be a perfect storm brewing for the NHS at the moment. So just outside this crisis, you have a decade of underfunding. You have a toxic environment that has driven away many important staff. You have a lack of funding for training, and you have a policy, a new immigration policy that is designed to keep away nurses that you need for the NHS. And you have Boris Johnson talking about hiring 50,000. This is a crisis. This is the perfect storm that's going to overwhelm the NHS. You have this virus where you're going to have frontline staff exposed to it. Many of them are going to get sick. Unfortunately, I think some of them are going to die. And there is no one to replace them for a number of reasons. Because there is a lack of training, because of an immigration policy, a toxic environment policy. Italy was able to deal with the situation somewhat because of its supply of extra beds available for intensive care. I don't know if that's the same situation in the UK. As far as I know, they are close to capacity. So how will the system cope with an extra 10,000 people or even 1,000 people requiring intensive care units?